Hello, I'm Dr. Robert Rubino, founder of the Rubino OBGYN Group, or ROG Group for short. I'd like to introduce a video series that we're starting called Ask Your Doctors. Today's first segment is going to be what goes on behind the curtain of a C-section. Many patients have anxiety about a scheduled C-section or often repeat C-sections. What's going to happen? Well, basically, it's a much more controlled setting where you come into the hospital early in the morning, the anesthesiologist visits you, you walk down the hall to the operating room area, you walk into the operating room itself, you get your regional anesthesia, which is what we call spinal anesthesia. You get draped and put in this surgical position, and your husband then joins you at your left-hand shoulder. A screen goes up, and you're going to be awake, and you'll hear talking amongst the staff and the doctors during the surgery. Behind that screen, we talk to each other, and you may hear some complex words and directions from one doctor to another, but don't be upset. Don't be anxious. We all know what we're doing. Everybody has their roles and their place. Sometimes when the baby's about to be delivered, we use a little bit of pressure on the abdomen. Some people don't expect that and they want to know what's going on. It's simply a little bit of help on the back of the stomach to help bring the baby out of the abdomen. So if you feel a little shaking and motion, nothing's wrong, everything's fine, but especially on a repeat cesarean section, there might be some scarring that makes it a little snug for baby to come out. But don't worry. Once baby comes out, we hand it off to the waiting pediatricians. They make sure everything's okay. Then the baby comes to you. You get to kiss the baby, and then dad goes off to the nursery with the baby, and we continue with the surgery. Sometimes it might take a little less time. We're done sooner, or sometimes it takes a little bit longer for some unexpected eventualities that happen, and we're equipped to handle them. So once you hear the baby's cry, relax. A lot of times anesthesia gives you something to help you rest, but don't be alarmed when you hear the shop talk of the doctors. Everything's planned and the entire room is equipped for anything that we may encounter. So I hope this answers some of the questions, and when you hear some of the $20 words being bandied about in the operating room, you won't get nervous or worried. Everything's under control. So I hope our first segment, can be shared with you, your friends, or loved ones who may have an upcoming planned cesarean section, so to reduce some of the fear and anxiety about it. Thank you, and look for our posts in upcoming segments of Ask Your Doctors. And don't forget, if you're 40 years or older, please make an appointment for a checkup and a mammogram. It's very important for your health, and we are one of the only practices in New Jersey doing mammograms with your checkups. Thank you again. I'm Dr. Robert Rubino, and this is Ask Your Doctors.